That's great. Thank you very much for the introduction. I just want to share a quick personal story as you were talking about my background. So my children are here this evening, my daughter Ava and my son Miles, and one of the things I was thinking about as you were talking about my background, it reminded me of last summer. My daughter was at a summer camp, and the kids there were learning about different occupations, and they actually asked the kids what their parents do for a living. So my daughter very easily told the instructors what my husband, her father does, how he works at Irving Oil. And then when they said, well, what does your mother do? She was totally stumped, totally stumped. Took a while to really think about it. And then eventually she told them that I run up mountains for a living. So then they probed a little further and they asked her and they said, so like, does she do anything else? And she's like, nah. She's like, well, she also does yoga. So my hope today, if anybody gets anything from this, I'm hoping that my children see that I'm not a stay-at-home runner who does the occasional yoga. So I want to thank you all for coming here this evening. I really appreciate the turnout. I thank the Alumni Office as well for this opportunity and the Devernon Trust for having this opportunity to share with you some of the work that we're doing. First, I really want to start off by taking you on a journey. I want to start by sharing a story of what it's like to live with complex care needs so that we can really share the need, so that you can understand the need for integrated service delivery models. After that, what I'll talk about is, I'm just going to move this here. After that, I'm going to talk about what we actually mean by integrated care and what that looks like here in Canada and across New Brunswick. I'll also share some of the challenges and opportunities that are associated with integrated care, including some of the opportunities for interprofessional education. And then I'll end off with the exciting parts where we'll talk about some of the different interprofessional integrated initiatives that we're launching here at UNB through the Centre of Research in Integrated Care. I'm probably going to forget to collect too. So remind me if I'm stuck on a slide. Okay, so I'd like to begin by sharing with you a story of Brian. He is a single parent who is the primary caregiver of his aging father. Brian is what we often refer to as someone in the sandwich generation, who are people who are not only caring for their children, but also their aging parents. So first, let me describe to you about Brian's son, Matthew. So Matthew was born with a congenital condition which has caused delays in his development. It impairs his mobility and also impacts his daily life. Matthew has to regularly go to various appointments. He's a 7-year-old who goes to various appointments. He lives in Tracadie and has to travel to Moncton for services with his family. So he has to do appointments with physiotherapists, speech-language pathologists, and pediatricians. So his father is constantly having to take him to these appointments, and rarely are they on the same day. Occasionally, he also must travel to the IWK, which is the closest children's hospital, where he has to undergo surgeries. Throughout all of these experiences, Brian has to repeatedly tell his son's story over and over again to all of the different providers involved in his son's care. He also has to advocate on his son's behalf in terms of having to go to the schools to let them know about the specific services he needs, whether it's just having easier access to a washroom. Despite these challenges, Brian is also the primary caregiver to his father, who is showing early signs of memory loss. After taking his father to multiple visits to his family physician and the emergency room, Brian's father, Raymond, is diagnosed with dementia, becoming one of 15,000 New Brunswickers diagnosed with this complex condition. To gather information to help support his father, Brian refers to the internet, which he finds to be very impersonal and overwhelming. Where Brian works full-time, and he also has 2 additional children who are very active in sports, in addition to caring for his child's complex care needs, he's became instantly overwhelmed with the sheer amount of appointments that he had to not only attend with his father, but also to not only have to book with his father, but also to attend with him as well. Once Brian made appointments with each of these care providers, so for example, his family physicians and the geriatricians involved in his care, and also with other services such as in-home care, the next hurdle was having to constantly retell his story to all of the different care providers. For Brian, this was literally a deja vu experience with the healthcare system. He wondered if he was going to be able to keep his sanity. He feels like he is the captain of a sinking ship and is literally on the verge of burnout. While the healthcare providers involved in his care are well-intentioned, they just do not have the extensive amount of time that Brian and his family need to find the services and resources to help meet his needs. Many of them also do not have the expertise of all of the current services and programs that are available because they're constantly changing, and they also are not aware of how to actually coordinate all these services. While this experience may seem extreme, this is just one example of a family who experienced struggles navigating within our healthcare system, and there are many other similar stories. I want you to imagine what it's like to be one of these families navigating our healthcare system. Imagine what it's like to be in Brian's shoes. When listening to this story, this may relate to you if you yourself you care for an individual with complex care needs, or if you yourself have complex care needs. But if not, I'm sure that everyone in this room can relate to the experience of having to retell your story over and over again to different care providers involved in your care. It is not surprising then that people find our healthcare system fragmented and difficult to navigate. Our team is working towards developing integrated service delivery models that are for people like Brian and his family to help make the healthcare system more convenient and coordinated to support their physical, mental, emotional, social, and spiritual needs, using personalized, family-centered models of care. For instance, coming back to the example I talked about with Matthew, and Dr. Campbell had introduced this as well, one of the types of models that we're implementing is called Navicare. In French, it's Soins Navie. And this is a model that it's a navigation center for children and youth with complex care needs up to the age of 25 to help them navigate the healthcare system. And this is a personalized, bilingual, free service for families, so for example, Brian and his sons, and also the care team, so for example, the teachers and healthcare providers that are involved in their care. So later in the presentation, I will share a lot more details about this program and others that we're developing in our lab. But first, I want to talk to you about what we actually mean when we say integrated care and what that looks like here in Canada. So before getting into integrated care, I think it's really important for us to understand what related terms like multi-professional and interprofessional care mean, because sometimes they get confused even within experts in the field. So I'll start with multi-professional care. And this is when team members work independently toward a common purpose. So as you see here, they're all working in their silos to contribute to their piece of the puzzle. So in most teams practice as multi-professional teams. Interprofessional teams take it a step further in that healthcare providers work collaboratively with patients to develop a shared plan of care. So rather than just bringing in their piece of the puzzle, the team members work independently together to pool their knowledge so that they work towards a common goal that is bigger and results in more than the sum of its parts. Similar to multi-professional care and interprofessional care, there is no common definition for integrated care either. And it's because integration means different things to different people. As you can see here on the slide, there's a lot of stakeholders that are involved in integrated care, and so definitions are shaped by the different views and expectations of these different stakeholders. But we use the World Health Organization definition for integrated care, and this refers to a patient-centered system approach that is achieved through the comprehensive service delivery of quality services across the life course. These services and programs are designed according to the multidimensional needs of individuals and populations. And as I talked about earlier, these needs are not just your healthcare needs. It's referring to your physical needs, your emotional needs, your social needs. And they are delivered by a coordinated team of providers working across disciplines, settings, levels of care, and sectors. So just to give you an example of that, when we talk about even within, say, the health sector, so this is when we talk about integration, when you have your family doctor collaborating with your specialist, but also across sectors. So example, with health and social services, we see that, for example, with patients who are in long-term care. So in short, when we're differentiating integrated care and interprofessional practice, when we're talking about integrated care, that's when we knit all of the services together, whereas interprofessional collaboration is cultivating a collaborative team environment, and it is a component of integrated care. So as you can see, neither really stands alone, and they both depend on each other. So that's the academic side of the presentation. So we can get that out of the way now that we've cleared up what we're referring to as integrated care. So now I want to talk about what integrated care looks like in Canada. So increasingly, we're recognizing that we need integrated models of care that are community-based and allow for integrated linkages across all levels of care and across sectors as well. And I really want to emphasize that when I say about community-based. So there's really a shift across Canada in trying to move care out of the hospitals and keeping people in the community and in their homes for as long as possible and providing them with care that's collaborative within these settings. Even still, in Canada, we're still really in the early stages of integrated practice, and we're seeing some models coming out in various pockets across the country. And one of the most common models that we're seeing is integrating different individuals or positions within the healthcare system. For example, having case managers or care coordinators or patient navigators really proactively guide patients throughout the healthcare system to help them with their unmet needs and to help them improve access to care. There is where it is a newer approach in Canada, there is some emerging evidence to show that integrated care models does lead to higher levels of patient satisfaction and improved health outcomes. But what we do have more evidence to show is what happens if patients do not have access to integrated care. And with that, we see increases in utilization of emergency rooms. We see negative experiences of care for patients and their caregivers and healthcare providers as well. We see poor access and fragmentation of care, and of course, deterioration of health, especially with individuals who have existing conditions, a deterioration in their mental health as well. So I want to shift now to talking about New Brunswick. So providing integrated and comprehensive integrated healthcare services for individuals with complex needs and their families is very challenging in provinces such as New Brunswick due to having limited resources, the diversity of communities, as well as our rural geography. Given the current situation, health service delivery reform is a major priority in our province. The government in New Brunswick, especially in the last couple of years, is starting to invest increasing time and resources into developing new integrated service delivery models. For example, in 2017, the province rolled out a province-wide program for children and youth with complex needs called the Integrated Service Delivery Program. Some of you may know it as the ISD program. And this is a really interesting project, and it goes back to when I was defining integrated care earlier, talking about how it's across sectors. This is a partnership in the department, with various departments in government, including education and early childhood development, the Department of Health, the Department of Social Development, the Department of Public Safety. They've also partnered with the school districts and the regional health authorities. So this is a very innovative model that's being implemented across our province that's showing that the province is heading in the right direction. In January of this year, they also implemented another new integrated approach where the Department of Health implemented what's called the Primary Healthcare Integration Project. And this is a partnership between, some of you may be familiar with the extramural program, Telecare 811, and Ambulance New Brunswick. And this is managed by Medavie Health Services. So these are just some of the things that are happening in New Brunswick, but what I'm really excited to talk to you today, and I'll talk about it a little later, are some of the different initiatives that we're doing here at UNB to improve the integration of care. So now I'm just going to talk about some of the drivers for integrated care in our province. I know a lot of you in the room do have a healthcare background and can certainly attest to some of these different things that we're seeing in practice. I'd say one of the greatest drivers for integrated care is around population needs. I don't think it's any surprise for anyone in this room to recognize that we do have an aging population here in New Brunswick. We actually have the highest percentage of individuals over the age of 65 in the country. New Brunswick does. So you know, with that, as people get older, they develop chronic conditions and multiple conditions, which leads to increasing complexity, and obviously with increasing complexity, we see a higher demand for services. But it's not just the aging population that needs these services. We have individuals with complex needs across the lifespan that require multiple visits to emergency rooms, multiple visits to specialists, in-home care. As I illustrated in the story when I talked about Brian and his family, this is not something this is something we're seeing across the lifespan. And these individuals and their families, they experience many care transitions also between care providers, between settings, and between stages of their illness as well, that also demands an increased need for integrated care. Another driver is that we're increasingly seeing the priorities around patient-centered care. I'm sure most of you in this room have probably heard language around patient-centered care and the importance of that. And a lot of the driver behind that is that it's patients that are demanding a better experience. Increasingly, patients are defining the ideal healthcare experience to be more like what they see in the service industry. They want more than just the traditional doctor-patient relationship. They expect convenient, quick, and integrated care. So this is a major driver around finding new ways of providing services. But probably the biggest driver is really around limited in financial and human resources. While individuals with complex care needs, they may represent a small segment of the population, they comprise a cohort who are high volume users of the healthcare system. There's lots of different statistics that are out there, but most often what we hear is that it's the 5% of the users, the high users, the top 5% of the population using the healthcare services use anywhere from 50 to 80% of the healthcare resources. A recent study that was done in Ontario showed that the top 1% of users in their system used 1/3 of the healthcare budget. So that's the top 1% used 1/3 of the healthcare budget, whereas the 50% of the lowest users used only 1% of the budget. So it's just to stress the importance that we really need to be thinking about finding ways to improve the integration of care for those high users within our system. And I think we would all agree, too, the sustainability of our healthcare system is dependent upon it. So now I'm just going to touch on some of the challenges, because it seems so obvious, why not just do this? But there's lots of challenges that we face when we talk about improving the integration of care, but there's also opportunities. In terms of the challenges, we see challenges at the individual level, at the team level, and at the organizational level. At the individual level, you always have individuals who are accustomed to assuming full responsibility, those who want to be in control, but we also see things like gender and cultural differences. For example, when we're dealing with interprofessional conflict, different ways of dealing with conflict. A lot of the challenges are at the team level, and that's because we have team members with differing levels of authority, power, expertise, and income. There's also issues with role clarification and overlapping scopes of practice. So for example, between licensed practical nurses and registered nurses, or also between medical doctors and nurse practitioners. There's lots of issues around overlapping scopes. In terms of organizational barriers, there are too many to name here, but there are obvious legal issues around scope of practice and liability, lack of time, but probably one of the greatest barriers is that the financing models do not actually allow for collaboration. For example, with fee-for-service models is one of the greatest barriers. There's many more. I could do the full talk just on some of the challenges, but these are some of the major ones. But just to recognize that there are so many opportunities that are presented with providing integrated practice. In terms of patient and caregiver experience, we know that there's opportunities to improve the experience for patients and their families and the care team. Care providers even report that they're more satisfied practicing on collaborative teams. We also see improved access to care, and this is across all levels of care and sectors. In terms of coordination and continuity, we see decreases in fragmentation of care, and we also see improvements in transitions in care. In terms of efficiency, obviously there's opportunities for more efficient use of services, and especially a reduction in the utilization of emergency rooms and hospital admissions, and reductions in duplication. In terms of safety, there's opportunities to reduce medical errors, and this can be from improved communication or also from less duplication as well. And of course, there's opportunities for improved health outcomes. So in summary here, we see better care, better value, and better health. And this, in what we call in healthcare, refers to the triple aim. So our team is a very firm believer around patient-centered care, and we believe that really the necessary step to overcome many of these challenges and to achieve the opportunities is to take a patient-centered approach. And in doing this, we really need to move behind what I would argue is a provider-centered system to a more patient-centered system. So when I say that, what I mean is, as providers, we often think about what information do I need, what do I prioritize, what do I think is important, shifting from what we need as professionals and providers to shifting to what are the priorities of the patient, what are their needs. And just going back to when I was defining integrated care, there are many definitions for integrated care, but inherent in every definition is the need to prioritize on patient needs. And it's not just at the individual level. It's not just when you're providing one-on-one care with patients. It's including patients throughout when you're designing integrated care programs, when you're implementing them, and when you're evaluating them. And that's one thing that we'll talk about a little bit later that you'll see is one of the things we do in our research lab is that we include patients and their caregivers throughout the entire process of designing, implementing, evaluating, and sharing the findings that we do with our research, because we know then that what we're doing is actually based on patient needs, and it keeps grounding us and making sure that what we're doing is patient-centered. But in order to be truly patient-centered, we have to make sure that team members are working collaboratively with one another so that patients are receiving the right care from the right provider at the right time in the right place. But how can they work together if they do not learn together? I know many of you in this room are healthcare providers, and I would guess that many of you did not have opportunities to learn with other professions during your training. But yet, we're expected when we go out into practice to be able to collaborate with other professions. So the solution to this is interprofessional education. So sometimes I may refer that to as IPE. That's what we refer to it in the academic world. So this is when students from 2 or more professions learn with, from, and about each other. And so these students could be from, say, nursing, medicine, respiratory therapy, any of the different professions. So they learn with, from, and about each other to enable effective collaboration and improve health outcomes. I really want to stress what I said there around learning with, from, and about each other. Oftentimes what we think we're doing is we'll put students, say, from different professions in a classroom, we'll sit them in a lecture just like this, have somebody stand up here and talk about a certain content area in a health profession topic, and we expect the learners to be able to collaborate because we've put them in a classroom together. That's just learning in parallel, and that is not interprofessional education. What we're talking about here for interprofessional education, there needs to be opportunities for the learners to learn with, from, and about each other. Okay, so this can happen in classroom settings, it can happen in the community, it can happen in clinical practice, but there needs to be that opportunity for dialogue so they can learn from each other. Here at UNB, we have been actively working on different interprofessional education opportunities for more than 10 years. The St. John campus is well known for its Tucker Park Collaborative, which Dr. Campbell had spoken about at the very beginning. And this Tucker Park Collaborative is a partnership between Dalhousie Medicine New Brunswick, the New Brunswick Community College Allied Health Center, and the St. John Regional Hospital with UNB. And the really major benefit, which is different from pretty well, I think, most institutions, all other institutions across the country, is that we are all co-located on the very same site, which makes opportunities for this type of collaboration much easier. One example of an IPE initiative that is taking place here at UNB, it's called Tuckerpalooza, and some of you in the room I know are heavily involved in this program, which is great. And this is a really great program because it's for all health professional students on the Tucker Park campus, so whether you're a nursing student, medicine, if you're in any of the NBC programs of respiratory therapy. So it's a mandatory experience for all of these students to come together in the first year of their training, very early on in their training, and it introduces them to the basic concepts of interprofessional collaboration, and it's an opportunity to start to socialize them very early on about the importance of collaborating with one another before some of these stereotypes start to become too entrenched that we talked about around some of the challenges. So with this particular, just to give you a sense of what this one's like, this particular IP experience, students come together to watch a video of an experience in the healthcare that did not go well. And then they work together in a group and have opportunities for discussion to talk about their thoughts on the video, their experiences in the healthcare system. They talk about how these experiences impacted them and their family, and then how they'll apply these key lessons throughout their education and once they're in clinical practice. And through this experience, they have opportunities to learn with, from, and about each other. So I've talked about some of the exciting interprofessional education stuff that we're doing here at UNB. But now I really want to shift to talking about some of the research that we're doing here at the University of New Brunswick. So last fall, our research team launched a new research center called the Center for Research in Integrated Care here on the UNB St. John campus. The overarching goal of the center is to be the hub for all collaborative research in integrated care for individuals with complex care needs in New Brunswick and across Canada. Individuals with complex needs can range from infants to seniors. As such, our research center is focused on individuals across the lifespan. Our research center, we refer to it as CRIC, Center for Research in Integrated Care, CRIC. It's a living laboratory that develops, implements, and evaluates integrated models of care that are patient-centered and meet the unique needs of individuals with complex care issues. One of the really exciting elements of that is that this is a living laboratory. So we work in partnership with researchers, knowledge users, and patients in a real-life setting where innovative ideas can be explored, evaluated, and modified as needed throughout the research process. And so I'll illustrate that a little bit later, but I want to emphasize that as we're doing our research, we are actually modifying it as we're going. So as we're getting new research findings, we are evolving the service delivery models that we're doing in real time. While it's me standing before you today sharing the exciting work of our center, I just want to emphasize that I am collaborating with a very large, diverse team of partners from a variety of backgrounds, many of whom here this evening. For example, our research center includes individuals who themselves have complex care needs or they're caregivers of individuals with complex care needs. We're working together with researchers, community stakeholders, members from the Tucker Park Collaborative, clinicians, regional health authorities, and government stakeholders as well. And we're all working together to create evidence-informed policy that truly reflects the needs of our population. On staff, I just want to say too that we have an absolutely amazing team, and also some of you are here this evening too. We have communication officer, we have a knowledge translation officer, which the knowledge translation officer's role is to help move our findings into practice in ways beyond just having publications. So trying to find new and interesting ways to get our findings into practice, whether that's through using theater or through using different ways of trying. So that's a really important element of our lab too. We also have program coordinators, patient navigators, administrative assistants, and a data analyst. It's a very broad team. So for anybody who's interested in doing research in this area, we welcome you to be part of this team and have access to the support that we have within our center. Trainees are also key partners at our research center. As the director of the Center for Research in Integrated Care, I have the privilege of co-supervising more than 30 undergraduate, graduate, and postdoctoral trainees in partnership with my close colleague, Dr. Allison Luke. And in fact, in just a few weeks, we're going to be hiring another 10 students, a little more than 10 students. I think we're somewhere between 12 and 15 students full-time to work with us throughout the summer on some of the various projects that you're going to learn about here in a few minutes. Trainees have the opportunity to be actively involved in promoting changes in health policy and practice. And just as an example of that, of those students, we're actually going to be assigning 2 students to be working full-time with we work closely with decision makers in government. So we had asked the Department of Health to give us a list of all of the research priorities that they have. They sent us a list, so we're hiring 2 of our students. They're going to be working under our supervision and co-supervision with the Department of Health, and they'll be placed in the Department of Health to work on projects that are a priority for government related to integrated care. So just an example of how our students they're not just sitting in an office, all summer working on, we actually have very experiential learning opportunities for our students to learn with diverse partners on the research team and in practice and with decision makers. In terms of research supervision, we have students at the undergraduate level. So for example, through Dalhousie Medicine New Brunswick, they have a 4-year research practicum. So we have some students who are involved in doing different research practicums under our supervision. We have honors students at the undergraduate level through UNB and Mount Allison University as well. And then we have graduate students through UNB's Interdisciplinary Studies program, Masters in Nursing and Masters of Applied Health Services Research, who are all engaged in graduate work or research assistant opportunities in this field of study. Our team is also involved in doing some clinical supervision as well. So we've also tested with having some students, so medical students and nursing students involved in, so nursing students shadowing our patient navigators. So they shadow some of the clinicians who are working within our existing health service delivery model. So there's opportunities for students at the clinical level as well. So I just want to give you a quick concrete example of what this looks like. So with using NaviCare as an example again, so having clinical trainees engaged in shadowing our operations. We also have nursing students, MBA interns, co-op students, and seed students who help us with our operational workings of the team as well. So for example, helping us with strategic planning and others. So we had 2 students who did an MBA, 2 MBA students, Masters in Business Administration students who worked with us on doing all of our strategic planning for this research center and the navigation center. So that was a really interesting way to bring in students from different professions. And then of course we have research trainees who are engaged in evaluating these different initiatives. So through this rich teaching environment, the students not only have an opportunity to learn from us as staff and faculty members, but I think most, and some of you are here too, would agree that a lot of the learning comes from learning from your peers, so learning from the other students within the lab. Okay, so at CRIC, we do have several ongoing research projects focused on improving the integration of care in New Brunswick and across Canada. And the way our center works is what we do is we first do needs assessments across the province and find out what the gaps are, what are the gaps in care, what are some of the barriers in care, and then we develop new integrated service delivery models to address those gaps. We implement them, and then we evaluate the new service delivery models. And because this is a living lab, we actually get to see the impact of the research we're conducting in real time in the lives of our patients. Our team is partnered on research projects securing over $35 million in research funding, with over $6 million of that being invested here in New Brunswick. This evening, I'm going to highlight 3 of the projects that are taking place within our lab. The first example is one that we've already introduced, which is NaviCare, or Soin Navi. And this is a service delivery model I developed in partnership with Dr. Alison Luke here at UNB and Dr. Rima Azar at Mount Allison University. And as introduced at the beginning of my talk, this is a research-based navigation center for children and youth with complex care needs in New Brunswick and their families. This service is bilingual and it is free thanks to a generous contribution from the New Brunswick Children's Foundation, where we were awarded $750,000 over 4 years. The center began its operations in January of 2017, and since that time, I think as of this morning, we're at about 136 families that we've served, so that's something that we're very proud of. And just to go back to what I was talking about earlier about how our center works, we ended up, prior to implementing NaviCare, we did needs assessments across the province. So we interviewed over 120 stakeholders. So this was family members and multiple stakeholders involved in their care across sectors, across health, education, and social services, to see what were their needs around providing care for children with complex care needs. And one of the central findings from this exploratory assessment was a need for navigational support to not only assist the families, but also the care team. So the care team, it came out very loud and clear in the findings, is that they find the healthcare system challenging to navigate. Even though they have the expertise, they find it difficult to know what current programs are available, what current services are available to meet the needs for their clients. When developing the center, we also did multiple site visits across North America. We did environmental scans to see what services and programs were already available. This all led to the development of NaviCare. So now I'm just going to show you a quick, well, I guess it's about a 4-minute video And it's going to give you a bit of an overview of NaviCare and give you a break from me.
Eyes and ears and mouth and nose and shoulders, knees and toes. Wow. My name is Hannah and I'm the mother of Jack. This is Jackson and he's 2. I heard about NaviCare through Jackson's pediatrician. Yes. Yes.
NaviCare Soins Navy is a navigation center for children with complex needs in New Brunswick. This can include children who have any condition, whether it's a behavioral, physical, mental condition. So this could include autism, diabetes, severe depression. So we support all of these children. The center provides a free personalized service that can be used by both families, either the youth or family members, but also the care team as well. The center is co-directed by myself and Dr. Rima Azar from Mount Allison University. So we started as 2, and we are now a team of over 20 researchers, clinicians, several students, and we also have a family advisory council who are family members from across the province who have a child with a complex health condition, who really oversee our center and make sure that we are meeting the needs of families within our community.
I joined NaviCare, their family advisory committee, about a year ago, because I wanted to share my expertise of the last 25 years of going through the healthcare system and the education system and all the challenges and problems that a parent can encounter. So I joined that to try and share my knowledge and expertise to help other families.
We have 2 patient navigators. One is a registered nurse and the other is a lay patient navigator who are there to help families, so children and youth, and also the care team find access to resources and services for children with complex needs. And these services and resources might be within their own home community, they may be across New Brunswick, and even outside the province as well.
When a parent or family or care provider call, the first thing I do is I usually listen to their story. And they can call with some identified needs, or it's something that we may tease out during the conversation.
So NaviCare has been a great support for our family. They've helped us find different programs that are offered for Jackson, and they've helped us kind of navigate the complex world of special needs. Yes. And right now they're actually helping me find some funding to help send Jackson to the States for 3 weeks to a special therapy program down there.
They're looking for services or resources, or it could be something specific like respite care. They may be looking for help navigating the health, education, or social services. As well, they may need help coordinating the care with their care providers.
As a parent, your focus is on your child and his or her care, and having to deal with all the logistics and the complexities is one more thing you just have to deal with.
What I strive to do really is to empower the families so that they may acquire the tools to navigate their child's journey.
NaviCare Soins Navy is also a teaching center, so we have several students that have opportunities to have mentorship within the center. For example, we have research students at the undergraduate, graduate, and even postdoctoral level. But we also have internships as well for health professional students, such as medical students and nursing students who work with our patient navigators and have opportunities to shadow them. And we're all very passionate about improving the integration of healthcare services for children and families within our province. And this is just an opportunity for us to use our skill set and our expertise to be able to make it a little bit easier for the families and the care team to be able to navigate this complicated maze of services in our province.
So if you're a parent with someone with complex needs, then the first place I would call is NaviCare, and they can help you sort through a lot of the noise and point you in the right direction as you go through your journey.
I think New Brunswick is very lucky to have a program like NaviCare for children with special needs, so thank you, NaviCare. Shoulders, knees, and toes.
Okay, great. So I just want to give a shout out. I'm not sure if the media team's still here or not, but I just want to give a shout out to the media team for helping us create that video. It's a lot of help for that. I also just want to share very quickly too, Just some of the, this is a project that has been going on since January of 2017, so we do have some preliminary findings. Overall, the families are reporting to be very satisfied with the service they're receiving through Navicare. And in terms of their own personal outcomes, they report feeling a relief to have someone to talk to, someone to be able to listen to their concerns and help deal with what their priorities are. We see that they're feeling like they have a reduction in their stress levels. They would note improvements in coordination of care, and also an increase in knowledge around the services and programs that are available within our community. Another thing too that we have found through our evaluation is that there are many gaps in our healthcare system for children and youth, and also many barriers to accessing care. So one of the things our patient navigators who are here this evening, they do is they actually collect data around these gaps in services and barriers to care. And what we've been doing, which we've started doing, is providing a summary of these gaps and barriers and sharing this with the Department of Health and other departments in government so that they can then see what some of these gaps and barriers are to help inform health policy and changes in our healthcare system. So we've developed very close relationships with government in order to share these pieces of information back and forth. So I just wanted to share that from some of our early findings. So that was the Navicare project. Now I want to talk to you about a project called Child Bright. So there was a pan-Canadian research team who learned about the work we were doing with Navicare, and we're really excited about that work, and invited us to be part of a network application to help improve the life outcomes for children with brain-based developmental disabilities. And I'll talk a little bit about that in a minute, but this application is part of a very competitive application a few years back, and our research team received $25 million in funding to establish this network. This network focused on children with brain-based developmental disabilities, of which $250,000 of that came from the New Brunswick Health Research Foundation, so that money was also invested here in New Brunswick. And, oh, what did I do? There. Our research team, because it's such a large grant, our research team is involved in one of the projects underneath the network. And this particular project is a pan-Canadian clinical trial where we're testing the use of an app to help youth transition from pediatric to adult services. So just to provide some context of what this means is, so when you're a child or youth, you receive care from pediatric doctors and pediatric care providers. And these providers are very experienced in dealing with children's behavioral, mental, and different health conditions. But once children or youth turn 18, they transition, they have to switch to seeing adult care providers. And generally with that, there are more expectations for these young adults. There's more expectations for them to manage their own health. And if that individual is not yet ready for this responsibility, which often happens with individuals who have disabilities, then their health can sometimes be affected. And we see that they miss medical appointments, they may miss taking their medications. And this whole process can be very overwhelming and stressful, this transitioning process. So in this study that we're doing across Canada, we're involved in testing this app. We've developed in partnership with researchers, healthcare providers, technology designers, youth, and family members. So youth and family members have played a big role in developing this app. And it's called the MyReady Transition App, and it's for young people who are aged 15 to 17 years of age and who have autism spectrum disorder, cerebral palsy, epilepsy, fetal alcohol spectrum disorder, or spina bifida. So this app was created to help these youth transition from pediatric to adult services. So through the app, the youth have their own virtual mentor as they journey through a city landscape and learn about visiting different places within the healthcare system, watching videos, completing challenges, and learning how to manage medical information and other skills to prepare them for adult healthcare. So as I mentioned, this project is being implemented across the country, and here in St. John, we're overseeing all of the Atlantic province implementation. And we're partnering closely with Dr. Sarah Gander and her team through Horizon Health Network to implement it here in New Brunswick and also at the IWK. So the last project I really want to provide a lot of details on here is around, it's called the Case Management Project. And hopefully earlier when I was describing there's a really a need in our healthcare system to address those who are the high system users. So remember I was talking about that 1 to 5% who use most of our resources. And one solution to address the frequent use of healthcare services is case management. A case manager is assigned to patients with complex care needs to ensure the coordination of their care. They work closely with other members of the care team and with the patient and their family to come up with a common care plan and to help facilitate and coordinate care across all sectors to improve both individual health outcomes, but also health service outcomes as well. Case managers are most often social workers or nurses, but it could be occupational therapists. There's multiple different professions that can be a case manager, or you may not even have a medical background. Over the past 5 years, members of our research team in Quebec have been evaluating a case management intervention tailored for patients with chronic conditions who frequently use healthcare services. And our research team recently received $2 million in research funding from the Canadian Institutes of Health Research to implement this project, this evidence-based case management intervention, in 10 sites across Canada, across 5 provinces, so 2 sites per province. So we received this funding, and we also received matching funding again from the New Brunswick Health Research Foundation of $200,000 to implement this project. So in New Brunswick, we've partnered with Daniel Doherty, who is the primary health care coordinator for Horizon Health Network, to implement this project at the St. Joseph's Community Health Center. Some of you may be familiar with that site here, as well as the Charlotte County Collaborative Wellness Center in St. Stephen. So starting this spring, adults in each clinic will receive this case management intervention over a 2-year period. And again, we're going to be implementing this project with those who are the highest users within the practice. So we'll be looking at those who utilize the emergency room most frequently, those who have the most appointments within the clinic, and have at least one chronic condition. So we're targeting the highest users within the practice. And I think it's obvious from what I've talked about already is what we're expecting to see is that this intervention will have not only a significant impact on the individuals within the practice, on their own individual health outcomes, but also on the broader healthcare system. Okay, so I'm just going to wrap up now, and there's just a couple of other projects that I just want to give a quick overview just to share with you to have a sense of some of the other things happening within our lab. One of them is a comparative program and policy analysis project, and this was also funded by the Canadian Institutes of Health Research and is also another pan-Canadian project where what we're doing is we're looking at different programs and services and policies across Canada that are strong cases, or strong models of integrated care, and we're doing an analysis of these models, and our plan is to then take what we're learning from this project to then implement some of these different models and policies and interventions here in New Brunswick through our lab. In terms of scoping reviews, this is something our team is very active in doing, in conducting scoping reviews, which are basically ways to systematically map the current state of knowledge and evidence in a particular area. So we're involved in conducting reviews in a lot of different areas, and I know a lot of our trainees are here, are leading some of these focused on transitions in care, best practices in patient navigation, and best practices in dementia care as well. So speaking of dementia, one of the things I really want to emphasize too is going forward over the next 5 years, the focus of our center, we've done a lot of work with children and youth. We're starting to do some work with adults, especially with the case management project. But going forward over the next 5 years, our priority is really going to be focused on the aging population, largely because of what we've talked about earlier, is that this is a priority area that we're seeing within our healthcare system that needs to be addressed. So for one example is that we're actually currently partnering with Dr. Pam Jarrett. She's a geriatrician with Horizon Health Network to implement a project here in New Brunswick to look at ways to improve the integration of care for individuals with dementia. And the work we're planning to do here in New Brunswick is actually part of a much bigger project that was recently funded through a European Union funding agency to conduct this project across Canada, the United Kingdom, Australia, the Netherlands, and Poland. And we're actually co-leads on this application to do this project. So this is something that I think is going to be keeping us very active and busy over the next 5 years or so, and will undoubtedly help families like Brian that I shared in this story earlier, and the other 15,000 New Brunswickers that are currently living with dementia. In terms of Quest, our team is also involved in leading a qualitative health research group. So this is called Quest, and this is a partnership that we've established back in 2017, where it's a group that meets monthly and we come together and share resources and try and build capacity around qualitative health research. And just the last item here is around research events. So our team is very active in hosting different events throughout the year. We have several events coming up in the coming months. The next event is actually taking place in May. We're partnering with the New Brunswick Institute for Data Research and Training to implement an evaluation workshop for increasing capacity in our province to evaluate health service delivery models. And this actually came from government, where they identified that there's a need to, because a lot of the programs that are introduced through government and even through the regional health authorities, there's these great programs, but then they never get evaluated. And largely, a lot of that has to do with a lot of the problem is we don't have the capacity here in New Brunswick to do these evaluations. So we've contracted somebody, an expert in British Columbia, who is going to be coming in and hosting this evaluation workshop to help build capacity. So for those of you who might be interested, just get in touch, because there still are some seats available. Another event is the Patients Den, which is probably my favorite event that we host. It's an annual event. We style it similar to the show The Dragon's Den. I'm sure most of you are familiar with The Dragon's Den. So instead of having venture capitalists decide on which projects to fund, we have a panel of 7 volunteers who, not similar to this style here, where we have teams come up and present and pitch their research projects, and we have a panel of 7 volunteers who determine which research projects get funding. And so we have funding within our program that we offer for this initiative if the projects are focused on integrated care. So they choose what they think are the top projects that they feel should be invested in, and those are the projects that do get funded. So we hosted this last year, and we'll be hosting it again this year in October. We're also in the process of planning a national patient navigation conference. So this is going to be an annual conference that we'll be hosting in Canada every year. We wanted people to come, so we decided to host it in Toronto for the first year. We thought more people would be able to come. So that's taking place in November for anyone who might be interested in patient navigation. So that'll be toward the end of November. And also our Family Advisor Council, some who are here this evening, Mike's here this evening, is going to be hosting. So the Family Advisor Council for Navicare, they're the ones who are informing our navigation center. They're also going to be hosting a workshop to help other families. So our Family Advisor Council, most have children with complex care needs or themselves have had complex care needs. So they're going to host a workshop to help other families who are living in similar situations. And then just my last plug, it's for next year. So there's an international integrated care conference that happens every year. Almost every year it's in Europe. We've always been too busy to go. We were hoping to go this year, just couldn't make it. But the exciting thing is next year, for the first time ever, it's going to be hosted in Canada. So if you're equally as passionate as we are about integrated care, it's a really exciting opportunity. This is one of the biggest conferences in the world. I can't speak highly enough about it, but it's something that's happening next year in Toronto, so just to put a plug in that to maybe try and fit in your calendar. All right, so through the integrated service delivery models that we're developing in our lab, we've had the opportunity to see the real impact that it has on the lives of the individuals using our services. And we'd really like for you to be part of that impact as well. There are many ways to get involved in our research, whether it's if you're a patient or a caregiver, to get involved on, like others in the room have, on our family advisory councils, or just participating throughout the research process. Or if you're an academic or a clinician or anyone involved in the community in different capacities, to get involved in the existing research projects that I've talked about, or even to develop new research projects. As I mentioned, we're really trying to focus on the aging population, so if you have any interest in that area, that's certainly something that we're willing to talk about and explore new projects. And we have a great team of support that I shared earlier who are all just excited to jump in on new projects to get involved in. If you're a student, I've mentioned many opportunities this evening about different opportunities for students, whether it's clinical opportunities or research opportunities. We've found really innovative ways to bring students from all disciplines, as I mentioned, MBA students and a variety of disciplines. We can find opportunities for you within our lab. And also, if you're a potential funder, to consider partnering on some of the different initiatives and the various projects that we're doing as well. We truly do believe that what we're doing is the future of healthcare. The research that we're conducting yields direct benefits in multiple ways, whether it's for the patients and families that we're serving, or the young trainees in our lab who are at the frontier of developing new integrated service delivery models, or even the healthcare system who is looking to labs like ours for informing evidence-based health policy. The research we perform and how we perform it evolves with each advance and each new conversation about how to meet the needs of the larger community. I want to thank you all for coming this evening, and thank you for listening to my talk. Our research team would also like to thank the New Brunswick Children's Foundation, the Jaroslawski Foundation, the Sir James Dunn Foundation, the New Brunswick Health Research Foundation, it's a lot of foundations, the Canadian Institutes of Health Research, and UNB, especially the Alumni Office, for having me speak here this evening in this opportunity, and every other funding and community partner who has supported our program of research. I hope you can see this evening that your support does much more than just allow us to write academic papers and do the traditional like what we're trying to do is to make a much bigger impact in transforming the lives of individuals across New Brunswick and beyond. I also recognize for you hockey fans that I am standing between you and Game 7 with the Leafs and the Bruins this evening. So with that, I'm going to close, and I also promised my son Miles that we'd be home in time for the start of the game. So with that, I will close, but I do want to thank you all for your attention and for taking the time out of your evening to come hear my talk today. Thank you.